Thank you for the opportunity to share my story. Most of my work is off topic with my family and friends, but in the theme of TED Talk and off map and maybe pushing us a little bit out of our comfort zone and hearing about things that are not necessarily fun to listen to, I appreciate the opportunity to do this. I am a pediatric nurse practitioner. I work as a medical provider in a fostering hope clinic. We are a multidisciplinary team, and we treat children, infants through adolescence. We do medical exams, we do developmental assessments, trauma assessments, and we do emotional and behavioral medicine and follow up with these children. I thought I would start by telling you the story of Johnny. Johnny is a 26-week premature infant with a normal gestational period of 40 weeks. He had many complications from his prematurity and was born to a mother with maternal drug abuse. He had colostomies and feeding tubes. He was in and out of surgeries, almost lost him several times. But after 4 months in the NICU, or neonatal intensive care unit, he was able to be discharged to home and to the care of his maternal grandmother. He was discharged in an afternoon, and we saw him about 12 hours later as a hospital follow-up the next morning. And the grandmother walked in like this with big eyes saying, "You're just gonna have to help me with this child." And for the next 4 months, we all in gave everything we had to this grandmother and this infant, pulling not only our multidisciplinary team, which included a dietitian, it included a legal aid attorney that helped us figure out safety and sanitation for the home that they were living in, to a social worker, to us as medical providers and an infant mental health therapist, all rallying around this grandmother. But over time, it became clear to us that she probably was not capable of caring for this very medically fragile child in her home. And the decision was made to remove him from her care and place him in a different foster home. I was devastated. I was heartbroken. I just knew that if we had figured out one more service or one more thing, one more education plan working with her, that she could have done it. But in reality, when we told her, she was very sad, but there was a tremendous sense of relief that came across her. And I think she knew long before we knew that she could not keep him in her care. I learned two very important things that day. One was, we cannot judge people who are unable to have children, their biological children, in their home. This grandmother brought generations of trauma with her into that moment. Poverty, poor education, poor parenting skills, perhaps some alcohol and drug abuse that had trickled down that put her in a place that she was maybe even cognitively not able to care for this little boy. And the second thing I learned is that sometimes the biological home is not the safest, healthiest, most loving place for a child to be raised. And that was very difficult for me. There are over 500,000 children in foster care in America, and about 10,000 of those reside in Oklahoma, which is a disproportionately large number compared to other state sizes. And our system is broken. We see children and actually give them further trauma once we have them in our care. The word is protective custody, and in reality, we are not taking advantage of the latest research and what we know to be true in caring for these children, and actually creating more drama and trauma. As a medical provider, we must get better care to these children. They come into us with developmental delays, physical disabilities. They are the product of fetal alcohol syndrome. They have school problems, behavioral and emotional problems. and we need team approaches to their care. You cannot have them go to just a general pediatrician and receive the care that they need. We have research that shows us that infants who are exposed to trauma and what they're calling toxic stress actually have the same response and results, and some of them actually carry a PTSD diagnosis. I have a 4-month-old that I cared for. I've actually seen this story repeated several times since, but the first one always has the biggest impact on you. Brought in by a foster mom. She had had him in her care for about 3 days, and he didn't smile, he didn't coo, he didn't kick. He gave no indication of hunger, no indication of a dirty diaper. He just sat there. He was coming out of a home of severe neglect. But rallying our team around him, getting him the services he needed, getting him in the right foster home, educating that foster family to the individual care needs that he had, in sometimes 2 weeks, sometimes it takes a few more weeks to months, but you see this child blossom. You see a child start cooing and laughing and loving and kicking and being the infant that you and I probably are accustomed to seeing. And we see it over and over again. We know that an infant's brain is placid. That means that if we take that child and take him out of a trauma or toxic stress situation and give him what he needs, then he can actually remap his brain. There's actually the whole epigenetic things that they can create changes in a brain so that he doesn't grow up to have health risks of stress and PTSD as an adult, and he doesn't fill our prison systems and unable to work in a regular workforce. So we know what to do, we're just not doing it. The second system involved in the foster system is the judicial system. For a child to go into foster care, it is a court order. And so a family or a parent has to stand before a judge and have their child taken from them and placed into the foster care system. We know that they are responsible for permanency. So does this child stay in a certain place? Are they reunified with a parent? Are the rights terminated from the parent? Or do we let them see both, live with a grandparent, but have the parents come? That's all done through the judicial system. That is currently a siloed experience. So a judge is making blind decisions about what perhaps I know as a medical provider or a social worker or a caseworker might know. And it ends up having lots of damage, further damage to the child than what they've experienced in their home. I have a 7-year-old little girl that I care for as a medical provider, and we first saw her when she was 4. She was removed from her home with suspicions of sexual abuse, but those allocations before the judge were not substantiated, and she was returned to that home. And for 3 additional years, until she was actually old enough to tell us, she stayed in the care of her parents. What she was able to tell us when she was 7 was that she was being sexually abused by her father, her grandfather, and her uncle. So we further damaged that child. She was in trauma, and we gave her 3 more years of it because we did not have the collaboration of all people involved in her care to make adequate decisions. The judges and the attorneys that work with these children need to be educated the same way that the medical providers do, so that we're collaborating for the good of the children in our care. And lastly, the child welfare system is broken. The child welfare workers, or the child welfare system in general, is responsible for the care of a child when they're in foster care. It's where they are they safe, are they being fed, are they being sent to school in the current foster home, or are they with a grandmother and supposed to not be seeing a perpetrating adult, but they're still coming over and seeing them. So the system has a lot of responsibility. The caseworkers that I work with have tremendous caseloads. They're supposed to be checking on children once a month, and there's no way, based on the current workload that they have, that that's possible. So sometimes the things you hear on the news or the situations are because a caseworker hasn't been able to really investigate a situation or see what's going on. We also have children that move through the system. I have a little guy, actually he's my pal. He's 8 years old. His name is Jim. He first came to see me when he was 5, and he was a terror. Fighting, kicking, hitting, violence beyond your imagination, at home, at school. And he was subsequently moved from home to home to home, kicked out of school after school after school. So by the time I was seeing him, he was actually in a stable home where he was loved and cared for, and whose foster parents were doing all they could and what the research shows that a person needs to do. And one day I was talking to him, reflecting on how he had been before, and he said, well, you know, my mom's in prison. I said, I know. And you know, I have 2 brothers that got to live together. I said, I know, I'm really sorry. And he said, I just had no place to call home. And he had been in 10 schools in 6 years. He had been in 5 homes in 2 years. And we have to stop. We have to keep these children safe. We need to hold them in place in the home that they're in and rally our collaborative effort around that foster family. It wasn't the foster family's fault. They had no education. What do you do with a bullying, violent young child? They were fearful for themselves and the other children in their home. But with education on how to deal with him, with proper medication, with proper school involvement, this child could have been kept from all the trauma that we as a system caused him. So it's a broken system, and it's very disappointing. We need legislative changes. We need policy changes. We need funding reallocation to be able to do the care we need to give. Sean Koff, who is at the Center on the Developing Child at Harvard, says, it is a social obligation. It is a moral imperative that we take care of these children. They are our children. It is our society. These are our workforce of our future. These are our children's classmates and friends. They're a workforce of our future. They will lower foster care rates. They will lower prison rates. They will increase workforce, but we cannot ignore it. We have to, as a society, address these children. So when you read about the child in the paper, please think, this is a child. And when you hear a parent having done a horrible thing, think, oh my goodness, wonder what that parent went through to be able to do that to a child. It's a generational trauma that we have to stop. But there is hope. There are models of creative thinkers and innovators all over the United States that are getting grant funds, philanthropy funds, foundation funds, that are little microcosms doing studies and research on what we already know needs to be done. There's a multidisciplinary model that the American Academy of Pediatrics has that we follow, but we need funding to continue it. There's something called the Safe Baby Court Team, which is a court-focused team where it's a collaboration between all of us that are involved in the care of a child, coming together on a regular basis and concurrently working with a family. So if a biological parent needs drug rehab, if they need domestic violence care, if they need a job, if they need education, you work with the parent so that they can work toward having their child back. But it's a short window, so that if you can't make the progress that you need to make, then we don't keep the child in foster care or in the system, if you will, for years and years and cause them more and more trauma. They quickly get to go where they can be adopted and in a loving, caring home. So there is a lot of hope, And you guys are out there. You're our future judges and medical providers and caseworkers and social workers to advocate for these children. I wanted to end on a happy note and finish up the story with Johnny. Johnny runs down the hall into our office now. He's talking almost in sentences. He has no tubes, no bags. He's receiving speech therapy, occupational therapy, physical therapy. He has an infant mental health therapist. There's a family therapy, and guess who gets to be involved? But his biological grandma. So she still gets to be part of the family. So there isn't that abandonment for either one of them. He's beautiful and he's wonderful, and he's saved from the system because he had foster parents who were all in, who were willing to do what it took, and were willing to get the education to know how to deal with a child like him. But if you raise his shirt, you see his journey. You see scars from all of his past. And if we could see inside, we would see all those scars too. But he is beautiful. And just like William Bentley, who taught us that every single snowflake is unique and beautiful, said the reason they're unique and beautiful is because of the scars of their journey. And that's how I feel about these children. They all bear the scars of their journey, but they deserve our very, very best. Thank you.